Many of my patients come to me believing that the constant tingling in their feet, that burning sensation that seems to come out of nowhere, and that feeling of walking on cushions are simply the inevitable price of getting older. The truth, however, is that these symptoms are rarely natural and almost always signal something deeper happening silently inside the nervous system. I'm Dr. Emily Carter, and if you've ever felt any of these signs, today I want you to understand something that can completely change the direction of your health. Imagine that every movement you make, every sensation that touches your skin, depends on incredibly thin wires running throughout your body. Those wires are your nerves, and when they start to fail, life becomes smaller, more limited, and filled with fear. Many people believe this is permanent, but they're wrong. There is a hidden reason behind this deterioration, and what I'm about to explain can completely change the way you understand your own pain. Neuropathy rarely appears out of the blue. It sneaks in slowly, almost like a shadow moving forward without being noticed. First comes occasional numbness, then the sharp jabs, then that feeling of fire in your feet at the end of the day. And in many cases, the constant fear of losing your balance or taking a fall. It's a progressive, cruel process, and the worst part is that many people spend years thinking this is just how it is. What you may not know is that there is one specific, extremely common factor capable of triggering this entire neurological collapse. Something so neglected in conventional medicine that it often slips past even routine lab tests. And when this factor takes hold, the protective coating around your nerves starts to wear down like an electrical wire with no insulation. The result is a cascade of failures that you feel as pain, weakness, and loss of sensation. The most surprising part is that fixing this problem can be much simpler than you imagine. Research shows that when this essential element is restored, nerves begin to regain their function in a matter of weeks. But before I reveal what this vitamin is and how it works, you need to understand what is actually happening inside your body. Today, you're going to discover that neuropathy is not a destiny, and it is certainly not just a punishment of aging. It's a warning sign, and when the body warns you, it also gives you clues about the solution. The story I'm going to share is not a theory. It's what I see every single day in clinical practice. And if you stay with me until the end, I promise you'll look at your nerve health with completely new eyes. To understand why your nerves start to fail, imagine your entire nervous system working like a complex electrical grid. Every wire has to be well insulated for the current to travel without interruptions. In the human body, that insulation is called myelin, a protective sheath that allows electrical signals to move quickly, cleanly, and efficiently. When that protection is intact, you feel steady on your feet and confident when you grip objects. But myelin is extremely sensitive. It depends on specific nutrients to stay strong and, more importantly, to regenerate. When one of these key nutrients starts to run low, the insulation around the nerves literally tears, exposing the inner wire. And when that happens, the messages sent from your brain don't arrive the way they should. That's why you feel tingling, burning, and even sudden shock-like sensations. The problem is that most people have no idea this destruction is happening. I've seen patients lose up to 40% of the sensation in their feet before they even realized something was wrong. Neuropathy, in most cases, doesn't hurt at the beginning. It quietly steals your quality of life, leaving subtle clues that we ignore for months. And by the time we finally pay attention, the damage is already advanced. The saddest part is that much of this damage could have been avoided with a simple nutritional intervention. That's right. We're not talking about some complicated, expensive, or experimental treatment. We're talking about something so basic and so fundamental that it should be on every doctor's radar, especially when dealing with adults over 50 or people with diabetes, long-term medication use, or restrictive diets. So why do so many people still develop neuropathy even when they think they're living a relatively healthy life? The answer lies in a combination of modern factors, from medications that interfere with nutrient absorption to changes in the way we eat today. Together, these factors create a true silent storm that gradually destroys the integrity of your nerves. And this is where the vitamin that can change everything comes in. A vitamin so neglected and yet absolutely essential to rebuild myelin and restore the body's electrical communication. That's what we're going to talk about now, because once you understand how it works, you'll understand why so many patients are able to turn their neuropathy around in just a few weeks. The vitamin we're about to explore is truly a game changer for anyone suffering from neuropathy. It is the central gear in the processes that keep your nerves alive, stable, and capable of repairing themselves. Without it, myelin breaks down. With it, in optimal levels, the body activates a powerful internal repair program. This vitamin doesn't just protect your nerves, it also plays a critical role in energy production inside the mitochondria, making sure each nerve cell has the strength it needs to function and to regenerate. When this vitamin is lacking, toxic substances build up and sabotage the structure of myelin, magnifying the damage. Many of the symptoms you feel are a direct consequence of this silent chemical process. And here's the critical point. Traditional lab tests, the ones ordered in most routine checkups, often fail to detect the early stages of deficiency. People with levels considered normal on paper may, in reality, be deeply deficient at the cellular level. That means thousands of people are walking toward neuropathy without any real diagnosis. When we look at more sensitive tests, like specific metabolic markers, the picture changes completely. Patients who thought their issues were just aging, posture, or poor circulation discover that in truth, they were simply drained of this vitamin. And when they start supplementing correctly, the body almost always responds in a remarkable way. Within a few weeks, many report that the tingling has eased, that the nighttime burning has lost intensity, and that their feet feel more alive again. In some cases, balance improves so much that patients start walking confidently after years of feeling unsure. This is not a miracle. This is pure physiology. In the next few minutes, I'm going to explain exactly how this vitamin repairs your nerves and how you can know if your levels are dangerously low. But first, you need to understand why so many people end up deficient without realizing it. And that's a part of this story many professionals would rather not talk about. Deficiency of this essential vitamin doesn't happen by accident. It's the direct result of factors that have become extremely common in modern life. One of the biggest culprits is the long-term use of medications for diabetes and heartburn, which directly interfere with nutrient absorption. These drugs alter key digestive processes, preventing the vitamin from entering the body even when your diet appears to be adequate. I see this every day in my office. People who follow a protein-rich diet and still show clear signs of neuropathy. Not because they're eating wrong, but because their body simply can't extract the vitamin from their food. In many cases, it's the medical treatment itself that triggers the deficiency. It's a cruel irony, but it's real. Another major factor is natural aging. After the age of 60, the stomach produces less of the acid needed to release this vitamin from food. That means that even a perfect diet may not be enough. The body starts absorbing less and less, and the first symptoms can appear many years before any formal diagnosis is made. Modern eating patterns also play a big role. Diets low in animal products or heavily restricted cut out almost all natural sources of this vitamin. And contrary to what many people believe, plant-based alternatives do not provide the active form the human body needs. They can even fool some lab tests, but they do not nourish your nerves. Digestive conditions like atrophic gastritis, celiac disease, or bariatric surgery make things even more complicated. They alter the intestinal lining, drastically reducing the body's capacity to absorb this nutrient. For these people, deficiency isn't just a risk, it's almost guaranteed. And if it's not identified in time, it very often progresses to neuropathy. Now that you understand how this vitamin gets depleted, you're ready to learn how to restore it properly, and more importantly, how to do it in a way that your nerves actually respond. The plan I'm about to share has helped thousands of people regain sensation, balance, and vitality. The first step in reversing neuropathy is to identify your real situation. It's not enough to look at basic lab work. You need specific tests that reveal what's happening inside your cells. When we detect functional deficiency, we begin an individualized protocol that combines active supplementation, dietary adjustments, and metabolic support. Choosing the correct form of the vitamin is crucial. In many cases, common drugstore options are not enough because they have to be converted by the body before they can work. If your system is already compromised, that conversion fails. That's why bioactive forms are the ideal choice. They're ready to go straight into the myelin repair process. They act faster, with better bioavailability and less metabolic waste. The route of administration also has a major impact on results. For people with good absorption, high-dose oral tablets can work. But for those who already have neuropathy, a history of interfering medications or advanced age, forms that bypass the digestive tract, like sublingual preparations, are usually best. In more severe cases, intramuscular injections offer even faster recovery because they deliver 100% of the dose directly into the bloodstream. Dosages vary depending on the goal. Maintenance and prevention require smaller amounts, but repairing active neuropathy demands much higher levels to speed up myelin reconstruction. That's why many patients only start to feel real improvement when they move into therapeutic doses, used for several weeks or months until the nervous system regains stability. Cofactor support is just as important. Other B vitamins help complete key chemical reactions, while minerals like magnesium regulate the electrical activity of the nerves. Powerful antioxidants improve blood flow and reduce internal inflammation, allowing nerves to receive more oxygen and energy for repair. Finally, diet sustains the process long-term. Natural food sources of the vitamin lock in the progress you've made, helping your levels stay stable. For those who don't consume animal products, ongoing supplementation isn't optional. It's essential. With the full protocol in place, the body initiates a genuine internal reconstruction, and in many cases, improvement is noticed much sooner than patients expect. When you truly understand what's happening inside your body, you realize that neuropathy doesn't have to define your future. Nerve regeneration is possible and absolutely achievable when your body receives the right resources. And the vitamin we've talked about today is the key that reignites this repair capacity, driving your body in a direction you may have once believed was impossible. I've seen people regain balance they thought was gone forever, feel the ground under their feet again, and leave behind nights of intense, burning pain. It's extraordinary to witness how the human body responds once it finally receives what it was missing. This transformation doesn't depend on luck. It depends on a physiological process that has been turned back on. The most empowering part is knowing you have control over this process. It starts with the right tests, continues with precise supplementation, and is reinforced by your daily choices. None of this requires extreme or complicated interventions. It's a simple, direct, deeply effective path, a path that thousands are already following, and now you can too. If this video opened your eyes to something no one had ever explained to you before, I invite you to stay on this journey with me. There is so much more about neuropathy, nerve regeneration, and neurological longevity that you deserve to know. My mission is to make sure that anyone who feels lost and hopeless discovers that, yes, there is a way out. I want you to tell me in the comments what symptoms you've been experiencing and for how long. Your story can help other people recognize the problem earlier and change their own path. Share this video with someone who struggles with nerve pain. That one gesture could truly change their life. I'm Dr. Emily Carter, and remember, your body was designed to repair itself. You just have to give it the right tools. Thank you for being here. I'll see you in the next video, where I'll reveal the 3 foods that accelerate myelin destruction and how to avoid them so you can protect your nerves every single day.